Now, Lubeck or ocean bean flap is done in when marginal gingiva needs to be preserved, when prosthetic crowns are present, to avoid non-pathogenic dehiscence, yeah, all of the above. The answer is all of the above. Now we will study how many flaps are there used in endodontic surgery. First is the semilunar flap, gingival and horizontal, triangular intrasulcular, rectangular trapezoidal, or submarginal, which is also known as ocean bean Lubeck flap technique. Now, the semilunar flap is a curved incision we are giving in the alveolar mucosa and the attached gingiva, where the incision begins in the alveolar mucosa, extending into the attached gingiva, and then curves back into the alveolar mucosa. It is not commonly used for endodontic surgery. It is just used for where aesthetic crown is present, where when there is a trephination required. Disadvantages are many, like poor surgical access or poor visibility, poor wound healing and scarring, increased hemorrhage, crosses root eminences. So it is not used in more frequently in endodontic surgery. It is also difficult to reposition, may not include entire lesions, predisposed to stretching and tearing. Now, gingival horizontal envelope flap is a circular horizontal intrasulcular incision, ठीक है, विथ नो वर्टिकल रिलीजिंग इंसिजन. सी, हमने यहाँ पे कोई भी वर्टिकल रिलीजिंग इंसिजन यहाँ पे नहीं दिया है, सिर्फ और सिर्फ हॉरिजॉन्टल रिलीजिंग इंसिजन यहाँ पे देते गए हैं. इट इज़ नॉट यूज्ड फॉर अपाइकल सर्जरी. इट इज़ यूज्ड फॉर रूट रिसेक्शंस, रूट एम्पुटेशंस, हेमी सेक्शंस, रिपेयर ऑफ सर्वाइकल परफोरेशंस और रिजॉर्प्टिव डिफेक्ट्स. Now, the triangular and the intrasulcular flap. In this flap design, there is a single vertical releasing incision. Here you can see single vertical releasing incision. It is given. And it is for advantages include excellent wound healing, minimal disruption of vascular supply, good visibility, and good flap approximation. Now, the disadvantages is more difficult to incise and reflect, may be limited of vascular supply access due to single, possible slight gingival recession which can be seen. Now, the rectangular or trapezoidal flap, we give two vertical releasing incision. With this design, the base of the flap should be as wide as so that the incision follows the direction of the tissue fibers and the blood vessels. Trapezoidal flap is similar to that of the rectangular flap, except that two vertical incision intersect the horizontal incision at an obtuse angle. यहाँ पे हम 90 डिग्री के एंगल पे कर रहे थे, यहाँ पे अब हम obtuse एंगल के इस पे कर रहे हैं, ठीक है, to create a broader base flap with the vestibular part wider than the sulcular position. Enhanced surgical access, excellent visibility.